Hi there, everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Tiffany Malone, who will be talking to us about what's new in MS from the Consortium of MS Sclerosis. No, that is not your topic. Oh my gosh, that's crazy. Ay, ay, ay. Well, she's going to tell you what it is because I actually have an old one in there. Um, anyway, I'm delighted to introduce our speaker. Sorry about that, Tiffany.
No
This
worries,
this
Deb.
is what you get for not breaking brand new scripts each time and just going ahead and filling in holes. So I'm delighted. Tiffany began her postgraduate career working in the field of neurology in home and community-based rehab programs. She joined the John A. Schaefer MD Multiple Sclerosis Achievement Center in November 2014 as the program manager, responsible for the development of program curriculum and facilitation of activities and education to promote cognitive, physical, social, and emotional wellness for people living with MS and their support partners. She transitioned to director of program earlier this year, and she also has a master's of social work, and she's an MS specialist. So we're pleased to have her today, and I'm going to turn it over to you, Tiffany.
Thank you. Hello, everyone, and welcome. Thank you so much for spending the afternoon or evening wherever you may be located. Maybe it's morning. I don't know where everybody is. But thank you for joining us. Let me get my screen shared here and get this loaded up. Deb, does that look okay on your end?
Let's see. Let's see. It
Yep,
does.
it's good.
Perfect.
Oh, awesome.
Perfect.
All right, let's get started. Well, I have been given permission that I can tell everyone that the MS Foundation has started and partnered with me, asked me to join them in a partnership of a quarterly series that's called Mental Health Matters. And I'm very excited about this opportunity. This is a topic, any mental health topic is a passion of mine, and I love speaking on it. So I appreciate the opportunity and thank you very much to the MS Foundation for this opportunity. So we're going to get started with this very first session of this quarterly series on talking about depression. This is a topic that I hear a lot in my work with people living with MS. They go together, unfortunately, but we're going to talk through all of that and hopefully find some ways that we can strategize and manage these mental health challenges. So the objectives that I've set forth for today, and hopefully everyone is in agreement to it, is that by the end of this session, you're able to identify the contributing factors of depression. You're able to incorporate strategies to manage those contributing factors, and that you'll be able to utilize resources to address the symptoms and the diagnosis of depression. So that's where we're going. That's the roadmap I have ahead of us. So let me get all of these facts out of the way, but I think it's important to know why we're talking about this. Depression affects about 50% of people living with MS, and that is more than the general population and more than people living with other chronic diseases. Now, I put that approximate 50% because that's the average. That's probably the most consistent average percentage that we can find right now. You will see ranges, and a lot of that range is because some people will report depressive symptoms, but may not be diagnosed with depression. So that's sometimes what causes the discrepancy, or maybe not discrepancy, but the big range of percentage that depression affects those living with MS. We'll stick with about 50% for today's purposes. Depression predominantly affects females. Also to note, females are more likely to seek and utilize treatment for depression. And females provide higher ratings for sources of information and support. So they find that those resources are helpful, and they have higher ratings about those resources. People living with MS are 7.5 times more likely to die by suicide. And I want that to not scare anybody, but I want that to be information that is valid and that you are aware of, because that's how serious this is. And that's why we talk about it. And that's why I'm passionate about speaking about this topic. No matter who you are, anybody living with MS, the more favorable form of receiving information is through a specialist, but also through family and friends. We trust those that we trust, right? We trust those that we're close with. We trust those that we feel safe with. However, this can lead to misinformation for a couple of reasons. Number one, family and friends may be doing the Google search, or maybe hear something by hearsay, or maybe get some information that's not entirely accurate. So we want to be mindful about that. We, of course, are appreciative of any information that we get. We just want to make sure that we check our sources and make sure that they're reliable sources. And a specialist, when we're talking with a specialist, they can bring on a lot of information to us, and that can be extremely overwhelming, especially when we're talking about a diagnosis like MS, and when we have that paired with a mental health challenge such as depression. So it's important that we may want to bring a loved one with us to an appointment when we're receiving that information, because then someone can take notes for us. We can make sure that we repeat what we heard. And it's an opportunity for someone else to be there to support us and the challenging information that we might be receiving during those appointments. And that all allows us to make the most educated decision for ourselves. Now, I hope you have actually been asked these two questions at some point. These screening questions for depression are now part of routine medical appointments. You might have a primary care provider who asks you these questions. You may have every provider asking you these questions, but hopefully this is not the first time you're hearing this. Those screening questions include: during the past 2 weeks, have you often felt down, depressed, or hopeless? And during the past 2 weeks, have you had little interest or pleasure in doing things? And I want you to consider how you feel when you have been asked those questions. Have you answered those honestly? Do you reflect on them for a moment before answering? So have you thought about the question, have you often felt down? Well, what is often? That's not a concrete word. That's not a concrete way to describe something. So we may not know what often means. And when it says, have you had little interest or pleasure? Do we know what that means? Right? That's not tangible. That's not concrete necessarily. But we want to make sure that we're answering those questions to the truest of our ability. So I talked about sometimes we have depressive symptoms, and sometimes we have been diagnosed with clinical depression. So I want to go over what a medical provider would be looking for in looking at a diagnosis of clinical depression. And those symptoms include sadness, irritability, the loss of, not just that there's little interest, but the loss of interest or joy in everyday activities. A change in appetite, which could be a loss of or an increase in appetite. Also a change in sleep disturbances. It can be insomnia, where I can't fall asleep, I'm up. Or excessive sleeping. All I want or can do is sleep. Agitation, slowing in behavior, fatigue, the feelings of hopelessness, worthlessness, or guilt, problems with thinking or concentration, and persistent thoughts of death or suicide. Persistent, that's like almost all the time, okay? Definitely more so than not. If you're experiencing any of those symptoms and you have not yet talked to a medical provider, I highly encourage you to do so. Okay, and we'll talk more about some of those contributing factors as we move forward. But I just want you to keep in mind that if you're looking at that list and it's speaking very predominantly to you, that you talk with a medical health provider, one that you trust. It doesn't have to be a primary, it doesn't have to be a neurology, it can be whomever you trust. So let's talk about the contributing factors to depression. I'm going to start with this image of this iceberg. Some of you may have seen this before. I've used this in previous presentations, but I like this, especially when we're talking about something like depression, mental health. Above the water, we only see a portion of the iceberg. But when we take a look like we are here at the entire thing, there's so much more to that underneath the surface. And when we're talking about something, a diagnosis such as MS, when we're talking about a mental health challenge such as depression, there's so many invisible symptoms. There's so much that's underneath the surface that people don't see. Sometimes we hide that on purpose. Sometimes we hide that because we don't know what else to do. Sometimes it's just hidden because it's hidden. It's not visible. And the part that is seen oftentimes is described as, oh, well, Tiffany wasn't quite herself today. Or she hasn't been as spunky. She hasn't told jokes like she normally does over the last several weeks. That might be the surface level, where underneath the surface, there's so much more going on. And let's talk about what some of those things might be. Anxiety. I find it very hard to discuss depression without anxiety. I find it very hard to discuss anxiety without depression. Anxiety affects people living with MS 3 times more than the general population. So not quite as high as depression, but definitely more so than the general population. And it affects about 40% of people living with MS. And I want you to look at that image there on the right-hand side. So anxiety and depression are together in the center of that circle. It's the nucleus, if you will. And around it, what can happen is that there is a strain on relationships. There can be communication deficits, word finding difficulties, difficulties explaining something, difficulties answering questions, difficulty thinking and making decisions. And again, those might be things that you're experiencing already with MS, and anxiety and depression can exacerbate those feelings. But I really want us to pay special attention to the one on the bottom right-hand corner, and that's social withdrawal, because this can lead to isolation. And if you happen to listen in on my previous presentation on social isolation and loneliness, we know that isolation and loneliness places a person at the highest risk of premature death over smoking, consumption of alcohol, being obese. This is a big, big deal, and we want to pay close attention to it. And again, that's where my passion comes from, is that we want to be able to manage these symptoms, know that they exist, acknowledge them, and address them so we don't help make the problem worse than it already could be. And let's talk about fear. Fear is caused by exposure to something that feels threatening, that's traumatic, perhaps that's painful. It can also be caused by hearing or knowing that somebody that we're close with or someone in our circle of support has experienced or been exposed to a threatening, traumatic, or painful experience. We can become fearful because we know someone else went through that and we learned of their experience, and that can cause fear for us. And what happens is that can lead to pessimism, mental distress. And over time, and with constant feelings of fear, that can lead to depression. And you can see there in that image that there's a lot there, because sometimes fear might not be the word that you associate with. You might say worry. You might say stress. You might say panic. You might say depression. You might say sadness. It's not on there, but you might say sadness. It might not be fear that you term that as. But as you can see in that image, they all go together. And in some cases, they can be interchangeable. "85% of people living with MS find at least one of their symptoms to be embarrassing. Bladder issues, bowel issues, sexual dysfunction, walking problems, the need to use a mobility device. There's a lot of embarrassment that can be felt when experiencing those things related to MS. And that can lead a person living with MS to not seek medical care. And in fact, a third of people with MS avoid going to the doctor because of that embarrassment. I don't want to talk about it. I don't want to admit that there's something going on. I don't want the doctor to write that down in my chart. I don't want that documented. Because when we talk about it, it becomes very real. And when it becomes real, we have less to hide behind. We have less of a barrier. We are exposed. And oftentimes we'll try to avoid that. And that's because of the shame that we might be internalizing. There's shame in depression, in experiencing depression and anxiety. There's shame in the changes and the symptoms that are caused by MS. And when there's shame, we're less likely to seek treatment. And the other contributing factor here is the social stigma. As a society, we are not very kind to each other, especially when someone looks different, quote unquote, or behaves different, quote unquote. And so a majority of people living with MS experience some level of social stigma. That can impact health, mostly because that leads to isolation, that leads to hiding again. And it leads to the inability in some cases to find answers of how to manage that and to live the best possible version of you right now. Guilt is something that I also hear a lot about with the people that I work with here in Sacramento. The guilt of the diagnosis, specifically of MS, that can be a contributing factor to depression. About the diagnosis, now that I'm living with MS, I'm letting someone down. I'm letting family down. I'm letting work down. I'm letting friends down. I'm letting myself down. That for some reason I'm responsible for this diagnosis. I still have not found anyone who has gone to the doctor and looked at a menu and said, I'll have the MS today. I'll have the depression today. Thank you. Looks lovely. But yet there's this feeling that there's responsibility for the diagnosis. I bolded the word burden. This is a huge, huge word that we talk a lot about. The burden that a person living with MS feels to their family, to their friends, to their loved ones. The guilt about not being able to work or engage in activities like we did before, the I used to be able to mentality, again, negates who you are today. There's guilt about needing extra care. I can't do things independently like I used to be able to do. My kids have to help me get ready. My kids have to help me transfer. My grandkids are having to help me now. My family has had to step in more to do things. And then there's the blaming, and I bold that word as well, the blaming of oneself for the MS getting worse. And there's a lot of guilt that comes with this. And so I said this word several times already, and I'll say it again. Isolation is a key piece to this puzzle. We don't want to go toward isolation. We want to go away from it, because isolation results in a significant increased risk of heart disease and stroke, hypertension, diabetes, and dementia. This may sound familiar for those of you who were able to listen in on my social isolation presentation. But if you already are living with MS, you really don't want to have to check any more boxes off. So we really want to try to avoid the increased risk of those medical diagnoses. It can increase the susceptibility for infections and weaker immune responses. It can accelerate cognitive decline. It can worsen the symptoms of depression and anxiety. We're already feeling like crap. Why do we want to make it worse? We don't. We don't. It can exacerbate the symptoms and increase the progression of the diagnoses that have been listed. And again, an isolated individual is going to be less likely to seek medical attention and less likely to follow through with treatment recommendations. There's been an excess Medicare spending on an annual basis due to increased utilization of hospitals and nursing facilities. We know that lower income adults express higher rates of being lonely than those making higher incomes or bringing in more per month. And there is an associated risk, there's an association with lower academic achievement and poor work performance. We want to be very mindful about how these things can affect our overall health and well-being. So there's a great amount of loss that can be felt, especially for a person living with MS. I want to remind us that loss is not just about a death. It's about something that we had that we no longer have. It can even be the loss of an idea that I had that is no longer available to me. And so grief is something that that's really important for us to talk about when we're talking about the overall mental health of a person, and certainly the overall mental health of a person living with MS. There are 5 stages of grief. Depression is one of them, as are denial, anger, bargaining, and acceptance. And the way that the stages of grief work is not linear. You're not going to start at one end and work your way exactly through to the other end. There's going to be fluctuation. There's going to be times where you may experience denial over and over and over again throughout the process of grief. There may be times where you're feeling more depressed. And then you might reach a stage of acceptance, but then something else comes up or something got worse and it brought you back to a previous stage or to a different stage of grief. We know that we have worked through one particular loss and through that grieving process when we are more consistently able to accept the loss and also recognize and honor that we had whatever it was, an experience, a person, a function. For a person living with MS, loss may seem like a constant in your life. There's changes in employment status. There's changes in the levels of function, your physical function, your cognitive function. There's changes in driving status. So perhaps you've been told that you can no longer drive, or you have decided that driving is not an option anymore or not safe for you anymore. And there's that loss. And there can be changes in relationships. And again, it's my encouragement is that when we're experiencing grief and loss, when we're going through the multiple losses, waking up every day wondering what's today's function, what function do I have, what function do I not have, what ability do I have today, what ability do I not have today, is to really focus on what is today. What do I have right now? When we focus on what we had, there can be a negative connotation to that. And we're leading ourselves into those depressive symptoms and into that depressive state versus saying, okay, let me focus on what I have today. And perhaps, again, once you're able to work through the grieving process, be able to find gratitude for what you had. Anger. So I've recently been talking about emotions and color and the relationship that different colors have and how they might connect us with our emotions or how we might feel with certain colors in our lives. And I bring that up right now because probably 100% what I have heard are that people associate red to be the color to represent anger. And I think about that as I think about this quote by someone who is living with MS and how she was describing anger for herself. And she described it as a small fire is smoldering deep inside of me. And I think about that and I think, yeah, I can definitely see red there. And what happens with anger is that it can take attention away from the positive points of our day and perhaps moments of gratitude. And it often can lead to the variety of, quote, why questions. Why me? Why now? Why this? Why not something else that's treatable? And unfortunately, I think probably 99.9% of the why questions we're never going to have answers for. When we focus on those why questions, the anger intensifies. And at some point, maybe it's not a smoldering fire, but it is a full-blown fire. It is a full-blown flame. And we want to be really careful about that. We want to be really careful how long we sit with that emotion, because it's not going to lead to anything healthy for us. And again, we're spending time and energy and effort on asking questions that we're never going to have answers for. So how can we turn that and change that? I do want to share with you that MS can affect the nerves and the frontal lobe of the brain. That's the part of the brain that's responsible for the expression and control of emotions. Now, I'm not telling you this to give you an out, not to tell you that you can blame your MS on everything, but I am telling you this because it's important that when we are experiencing those symptoms of depression, that we do speak with someone, because there might be a treatment option and you might be able to feel better. And I also want to point out that a person cannot necessarily control or prevent depression with willpower or determination. We can't just will it to happen. However, we can control what our level of participation in the management of depression and its contributing factors is. We get to control that. We get to control when we're going to say, yes, it's time to talk to someone. Yes, it's time to explore those treatment options. Yes, I'm ready to feel better. So we can't just sit in our isolated room and expect for it to drop in our laps. We do have to work for it. When we do have the willingness, when we do have that willpower to take the next step and talk about it and explore what might be out there as far as the management strategies, that's when we feel in control. So I've talked at you for about half an hour now, and so I want to hear from all of you. So I hope, I did not clear this. I hope that we are able to use the chat box, but if that's available to you, I want to ask you, and I'd love for you to answer, what are your coping strategies when dealing with depression and or the contributing factors of depression? So any of those factors that we just talked about, I want to know what you're currently doing. And if the answer is nothing, I want you to put that in. But I want to hear what you're doing to cope and to manage with depression and its contributing factors.
Thank you, Tiffany. That was awesome. And so I'm going to suggest to everybody that's been with us before that are familiar with the chat version and the Q&A, if I can keep everybody putting their questions and comments into the Q&A, it's going to be much easier because as the Facebook questions come in, Bobby is going to put those into the chat side. So either way, you're going to get your questions answered, but if you can make a conscious effort to put them into the Q&A area, that would be very helpful. Okay. Let's go to the very first one that came in. And that was, someone wants to know, well, they want you to know that they have anxiety and they would really like to be treated for it, but they find most doctors want to treat with antidepressants, and that's not the way that this person wants to be treated. They said they're not depressed. How can they get the doctors to listen?
Well, we're going to get to this in a second, but I will tell you that the most effective treatment for depression and anxiety is a combination of medication and talk therapy or counseling. So I know that people can be resistant to medication. In some cases, it is a necessity. I don't know this person, obviously. So what I would recommend is to continue to talk with providers. If you're not comfortable with that, with what they're offering, let them know that and ask them, what are my other options? What are my non-medication options for treatment? And if they're not able to provide any for you, then perhaps looking at there's Eastern versus Western approaches to medical care. Maybe you're one that is more inclined to go to an Eastern medicine provider and find out if there's other options that are more suitable for you. It's such an individualized thing. I know we say that a lot in this field, but that it's hard to be able to pinpoint exactly where to guide you. But we'll throw out some other strategies in just a moment that you might consider that you can do on your own too, that are non-medication related.
Okay. I'm sorry, but I cannot pronounce the name correctly. I believe it's Duvroska is asking, let's see, she says, understanding how I am feeling and what makes me feel in that way. Normally that helps me to understand my emotion and deal better with it.
I love that response. Thank you so much for sharing that, because that's when we can tease out the real stuff versus the anticipatory stuff or the past or those other emotions that we might be feeling, like fear and anger and worry. So when we're able to determine, if we can, what was the cause, what was the source of making me feel that way, then I can go back and I can manage, I can address, I can look at that situation or that experience or whatever that was and work with that. It doesn't have to lead to depression. It doesn't have to lead to these really strong emotions that I'm going to live with for a significant period of time. When I can go back and address the actual event, then I can move on.
Thank you. Great answer. Tiffany, are you done with your presentation? We're now in the Q&A, or you have more slides?
I think there's a couple more slides after this. I just wanted to find out where people were with their coping strategies. But if
Right.
there's questions, we can absolutely go through them too.
Okay. Let's see here. Sometimes I allow myself to rest if I need to, walk outside as well as write down my thoughts. And
Oh, there's a
that's
lot
actually
there.
the same person who said, um, understanding how I am feeling and what makes me feel in that way. Normally that helps me to understand my emotions and deal better with it. Same person. So,
Yeah, so taking a rest break, highly recommend it. As long as it doesn't lead to excessive resting, I'll say. When that becomes our norm, we want to be mindful about that. But taking a break from the situation, from the emotion, from thinking about it. And oftentimes I know that people hang on to their thoughts because they don't want to forget it. What I love the idea of journaling, and I say journaling when you think about like dear diary. Doesn't have to be like that. It can be that you're typing something, that you're texting to your phone. Getting it out, number one, gets it out and you're not cooped up with it. Okay. The other thing that it does is that it keeps it in a safe place. I can go back to that notebook. I can go back to that document on my computer. I can go back to that note in my phone. And I can access it when I'm ready to deal with it, when I'm in a better headspace, when I have more information, or when I'm ready to talk about it with someone. But you have it in that safe space and you don't have to carry it.
great. Arian is giving some coping strategies that she uses. Journaling helps her with depression. And Susan says that her coping is books, movies, and distractions.
Love it.
And Dawn says medication, Trintilix. Have you ever heard of that? Trin Tellix. No?
It's not ringing a bell.
Okay.
Is that the medication name?
Yeah, must be medication Trintilix. So
Okay.
let's see.
And full disclosure, I am not a provider in that sense. So I may not know all of the drugs.
Well, Kelly says music helps a bunch and nature. So that's nice.
Yes.
Connie says that she shares her coping. Let's see. Isolation and avoidance are frequently easier for her emotionally. Her coping, let's see. Her coping strategies are getting out into nature, breathing fresh air, breathing exercises, singing, going on a scenic drive, having coffee or lunch with a trusted friend, and feeling able to vent. And then it did come in, Trintellix is used to treat major depressive disorder.
Okay.
David says breathing and stretching works for him. And let's see, Alicia says that sharing, let's see, I think about my wonderful husband, that helps her. He helps me so much. Think about him and smile. I use CBD gummies for stress when my husband is driving several hours to see his family. So very nice.
Well, thank you. Thanks, Deb, for reading all those for me. And thank you to everyone who contributed to that discussion. I love the distractions. I think they are extremely useful. I highly, highly support them in moderation. Let's not be completely removing ourselves and avoiding. We're going to talk about that in a moment, but let's not avoid the situation. Let's not avoid the feeling. It's there for a reason. It's telling us that something's off. It's telling us that something's not right, wrong, off, whatever it might be. But we want to pay very close attention to getting back to whatever that is so that it doesn't get worse and we're not just adding on to it. When we get used to going to the distractions and that's all that we're doing, then we're carrying it somehow, some way.
Okay. Can you please specify what link you are referring to? Bobby, is that one for me?
No, there's somebody else that's attached to that in the chat, and I'm just waiting for them to respond.
Oh, 'cause I didn't see it in the chat, so. Okay, that makes sense. Thank you. Okay. Kelly says, thank you. Excellent as always. That's a
Well,
note.
don't go anywhere yet. We're not done.
Oh, cute. Okay. Well, I don't know. As of right now, we don't have any more questions.
Okay. All right. Well, let me offer some coping strategies that maybe make sense to you, maybe hit home for you. Maybe you are already looking at this and applying this in your lives, and maybe this will spark something that might be helpful for you. So I put coping with MS. I will also say that this is for coping with MS and depression. The red flags, the things that we want to avoid. We want to avoid avoidance. Okay, I know that sounds contradictory, but follow me. We want to avoid avoidance. We don't want to isolate. We don't want to avoid. We don't want to dismiss what's actually happening. Again, we can distract ourselves for a temporary amount of time, but let's make sure that we are going back and addressing whatever it is that might be contributing to those feelings of depression, guilt, fear, all of those contributing factors. Emotion-focused coping. When we are driven by negativity, when we are always able to see the negative side of the coin, when we are paying more attention to the contributing factors of depression, more so than not, that's when we're coping in the mess. That's when we're digging deeper into the mess. And we're finding comfort in that negativity. We're finding comfort. We're finding some sort of blanket of depression, of sadness, of anger. And sometimes that's because it's a mask, because we don't want to deal with what's actually happening. We don't want to recognize or acknowledge the reality of all of this. So we can cope under emotions, and we don't want to do that. That's a red flag. That's going to lead us down an unhealthy pathway. Drugs and alcohol, they're a temporary, quote unquote, fix. They're going to mask what's going on only temporarily. And when that numbness, when that distraction wears off from drugs and alcohol, then what we are trying to avoid potentially is going to feel even worse. And trust me, it's not going to go away. It will still be there for you to face it. So drugs and alcohol, that's definitely a red flag. And again, isolation. So let's look at what we can do. And dare I say, what we should do. We should cope with problem-focused coping strategies. What do I mean by that? I mean, going back to the response that we had earlier from one of the attendees, is that I look at what the source of the problem is. I look at what caused that emotion, and I address that. That is problem focused. That's looking at what are the events, the situations, what's the real information. And again, if I'm not ready to address that, I can put it down in writing. I can put it in a safe place until I can go back and address it from a problem focused perspective rather than an emotional perspective. We need to move our bodies in any way, shape, or form that can happen. Okay, when we're feeling like the ability is less and less and less, when we're feeling more pain, when we're feeling more tightness, when we're feeling more inability, we're less likely to move. But we need to keep moving as much as possible in any way that that's available to you. I know some of the respondents were about breathing, deep breathing, meditation. Meditation, people hear that and it's not for everyone. And I totally get that. I am not one to sit still and listen to someone telling me to inhale and exhale. It's not my style. But there are ways that you can participate in mindfulness, in meditation, that isn't just about deep breathing. It can be about thinking about a positive mantra or a statement that you might repeat to yourself. It can be about going in nature and going for a nature walk or stroll and really looking at the specifics of what you find out in nature. There's lots of ways to meditate. I invite you to explore those options if you haven't already. And the last two green flags on there is about staying connected, staying socially connected and staying connected with our healthcare team. Avoiding, not avoiding avoidance, avoiding that isolation and that not inability, but that feeling like I don't want to talk about it with anyone, or I don't want to bring this up. I don't want it to be looked at as a problem. Let's stay connected with others. We are biologically driven for social connectedness. We are biologically driven to have those social connections in our lives. So let's not take that away. We wouldn't take away food. We wouldn't take away water on purpose. We wouldn't take away shelter on purpose. Let's not purposely take away our social connections. And this last slide is a bunch of resources. So Psychology Today is a resource that is recommended in the mental health community in the United States. It is a resource where you can go on and you can answer all of these questions. You can filter through, you can put in where you live, and what type of therapist you're looking for. So what symptoms or what challenges have you been faced with? What experiences have you had? And you can click on each of those. You can click the gender if you have a gender preference of your therapist. You can click it, you can determine if you want to meet in person only or if virtual might be an option for you. And it will pare down what the options are of vetted, verified therapists on this website. And I have actually had members who have had, and people I've worked with who have had success finding a therapist through this resource. Mental Health America, the National Alliance on Mental Health Illness, NAMI, those are both resources for mental health diagnoses, mental health symptoms, and really invite people to look at different ways of managing it. There's lots of different resources on there that are non-medication related. So maybe this is a good place for that person to go to. Just lots of different resources and things to think about as it relates to mental health, the health of our mental health. I'm a big proponent of mindfulness apps, and there are so many. I could not list even a few of them. But what I wanted to start with is one called Calm. And this has been recommended in the mental health community. There's an app and there's an online site that you can go to. There is a free trial and there is a paid subscription for Calm. But there is a plethora of mental health symptoms of stress, anxiety, a change in a relationship, grief, worry, sleep. You can determine what it is that you want to focus on, and it will guide you to the right mindfulness approach or meditation approach, and gives a lot of variety to managing depression and other mental health diagnoses that aren't medication related. There is medication. So this is where I was talking about that there is research that says that the best treatment plan is a combination of medication and talk therapy, also known as counseling. I'm a big proponent of both. I'm also a proponent of doing what works for you. So I'm not here to tell you that there is an exact prescription that you should be taking. I will also be very clear that medication is complicated. Medication for depression and anxiety are not a take a tablet and you're going to know instantly that it worked. It's not like Tylenol. It's not like Advil. It's not like any of those instant relief forms. Unfortunately, it takes several weeks in some cases for you to know if it's working. And if it's not, then it takes time to come off of that particular medication. And then it takes that time to get back on a new one. When you are not feeling well, when you're feeling depressed and anxious and fearful and angry, the last thing you want to do is sit and wait for a medication to maybe or maybe not work. But I can tell you that if you put in the work and if medication is recommended for part of your treatment and you find the right fit, it is worth it. That's why talk therapy goes hand in hand with medication, because talk therapy can help us get through those medication challenges. Support groups are also a wonderful resource. I also will say that there are support groups that can not work for people. So if you're finding yourself in something that's super negative, that's not helping you, get out of that group. There are more if that is something you're looking for. And the last thing that I want to say is that if you or someone you know are having thoughts of suicide, or having thoughts of harming yourself or themselves or someone else, please, please, please pick up the phone and make a call. The phone number at the end there, the National Suicide Prevention Hotline, there are amazing, amazing people that work for these hotlines, that work for these organizations that are there to support anybody who is feeling having thoughts of death, of suicide, or of harming someone else. So please, if you know of anyone, including yourself, that is experiencing those thoughts and feelings, please make a call.
Thank you. Wow.
And Deb, I think that is where
That's
we'll
it.
go to questions.
Tiffany, thank you so much. You are incredible. I mean, really, the MS Achievement Center is so lucky to have you. And we're lucky that you're actually willing to teach all of us and share this information. Great resources. So for anybody who might want to ask a question, but want it to be anonymous as opposed to just spitting your name out there, you have that option on your Q&A app to do it anonymously. Otherwise, you can just obviously do it normally, and we will take those questions. You know, Becca said that a Reiki is helpful also. Or Reiki, is it Reiki or Reiki?
I've heard it pronounced different ways. I've heard Reiki.
Mm-hmm.
Yes, it absolutely is. It's a form of, it can be considered meditation. It also can be a movement, or is movement. So I am not a Reiki therapist, or facilitator. So I am not an expert by any means, but I have heard really positive things, from those that do utilize that as a management and coping strategy.
Wonderful. Oh, Kelly, I think is clapping her hands. I don't know what that little icon is. I think it's Kelly. I hope that's what you're doing, clapping your hands on there for her. And I agree. I'd clap my hands too. So thank you. Yeah. Does anybody have any questions? You've really been so thorough. And what I really want to tell everyone is, if I know it was a lot of information, it was a lot of helpful hints. And so I hope that everyone understands that you didn't have to write it down, because everything we've done today is recorded and it's going to be available forever on our YouTube channel. It will be on Facebook also, but it will be forever, I think, for years and years and years on YouTube. So people can go at their own leisure, stop, go, stop, go, stop, go, to get the information, to get the resources. So I'm always so grateful that we have that available. As far as drugs, who should I see? General, neuro? Feel like they are missing something and just guessing.
So my recommendation is to ask for a referral to a psychiatrist. Medication management for mental health diagnoses really should be seen by a specialist, and that specialist is psychiatry. And I know there's a stigma to that specialty, but when you are looking for something to address that particular part of your overall health and well-being, go to the specialist. Just like you would with your MS, you would go to neurology, go to psychiatry for your mental health. Yes, neurology and primary care can prescribe antidepressants, can prescribe anti-anxiety medications, but a psychiatrist is really going to know the ins and outs of each one and will be able to talk with you about what you're experiencing and what hopefully is the best fit for you. And then if that doesn't work, then you can go back and that specialist can look at why didn't that work? What are you still experiencing? And what might be the next option?
Wonderful. Okay, everybody, I know you all have questions unless she totally answered everything that you've ever dreamt about. This is your opportunity. She's so good. Okay. Well, we'll give everybody another second, and it's around that time anyway, I think.
So, Deb, I see that someone is maybe trying to raise their hand.
Oh,
Are we
yes,
able to?
Yes. Let me see. Let me see who it is. Yep, it's Jonah. So Jonah, I'm going to allow you to talk. You just have to unmute yourself. You can go from there. There you go.
Sorry, I didn't mean to raise my hand.
Oh, that was an accident. Okay, thanks, Jonna.
While I'm here, Tiffany, you done
Yeah.
good. You done good.
Thanks, Jonna.
Take the day off.
Take the day off. I like that. Okay. Let's see. We have somebody who said, I realized something about myself and my attitude toward myself and coping with MS. So I guess your presentation brought all those things about. Pretty cool. Becca said, what's the tube channel name?
I think that's you.
Oh, are you
What's
too?
your? Yeah.
Yep, msfocus.org, MS Focus. You could look under MS Focus, you could look under the Multiple Sclerosis Foundation, you'll find us. Yep, good question, Becca. And it will not be up for a couple weeks. Usually the young lady who does all of that gets it up within a week or two, but it'll be there. You could do it all you want. Let's see. I think that's it. I mean, I think you gave them a whole lot to think about for sure. For sure. So,
Well, I will say that if anyone has any questions or wants to reach out to talk about any of that further, Deb, do they have contact information for you guys? And that you could give my information if needed?
yes, because the reminder email that we send to each and every one of them is your way to just respond afterwards. If you wanted to use that and respond to us, that will get to the right person. Yep, it'll go to Bhavia, then it'll go to me, then it'll go to you, and you will eventually get that. Somebody is saying, Ariane says, in class, we discussed practicing a positive attitude. Is there something to fake it until you make it?
Yes, there is. Again, that's right up there with the distraction topic. So you want to be careful about how much you're quote unquote faking it till you make it. Because sometimes we don't reach the make it part. And so we want to be careful about what potential damage, harm we're doing to ourselves by faking it and not addressing the reality of the situation. Again, we can do that temporarily. We can distract temporarily, but at some point we really want to say, okay, I'm ready to dive into this and get this resolved or get this addressed.
Kelly said, I realized something about myself and my attitude toward myself and coping with MS.
that is fantastic. I'm really happy to hear that. I'm really happy that people are recognizing things, and maybe if you don't know what to do with it, just jot it down for now. Just keep it somewhere safe for right now. And in time, you will find the time and the heart space, right? When you're ready to address it.
Great information. Okay, everybody, I think that brings us to the end of our time. Unfortunately, I could listen to you for the next hour. If you missed any part of this conference, as I said, it has been recorded and it's going to be available through the MS Focus Facebook and YouTube channels. Reply to your registration email that I mentioned for information on how to access the recordings, or maybe sign up for our newsletter to learn about the upcoming events. Our next teleconference is scheduled for Monday, October 28th. I believe that's this coming Monday at 4:00 p.m. We have Dr. Herb Karpatkin joining us for that hour. He's going to be doing his Q&A that he does every other month. He answers as many questions about PT and MS within that hour. He's like the Energizer Bunny. So he's really great. As you leave the conference today, a survey will appear on your screen. We ask that you take a minute just to fill it out, because what we're looking for is to find out what is meaningful to you. And, you know, it's going to give us suggestions for future topics. It's going to tell us if you liked what you heard. Do you want to hear this again? I'm sure you're looking forward to the next ones of these series with Tiffany. So our sincere thanks to all of our attendees for your participation, and especially to Tiffany for sharing her time and her expertise with all of us in a way that was so warm. And I'm like on a high right now, because I learned so much, and I don't have MS, about, you know, just life and how to experience all the feelings that we get, what to do with them. So it was really great, Tiffany. Have a great evening, everyone. And we look forward to seeing you again next time. Thank you.
Thanks, everyone.